Hi, I'm Antonio Mora. We cannot let the cure be worse than the problem itself. President Trump's now infamous tweet launched 1,000 news segments, 1,000 opinion pieces, and many more than 1,000 arguments around the country. Most simply put, the debate was framed as a health versus wealth, a medical apocalypse or economic devastation, risking lives, or mass unemployment. The argument against a strict national lockdown usually went like this. We should ride it out because a severe recession or even a depression would harm far more people than COVID-19, which, in the end, they argued, was not much worse than a bad year of the flu. The bad news we've gotten over the past week should put that flu argument at least partly to rest. Over the past decade, the seasonal flu has killed an average of about 37,000 Americans a year. But those deaths are spread over a flu season of at least 7 months. COVID-19 has killed more than 6,000 in just the past week. Does the flu overwhelm hospitals? No, COVID-19 has. Have you heard of individual hospitals unable to provide care because of how many of its employees were sick with the flu? No. Have you ever heard of young doctors dying from the flu? It may happen, but I sure haven't, definitely not in the way we're seeing it with COVID-19. As Republican Senator Tom Cotton said, they don't turn the Javits Center into a field hospital for the flu. They don't bring in ice trucks to back up the morgue for the flu. Also, the novel coronavirus is believed to be almost twice as contagious as the flu. There is a vaccine against the flu, but it will likely be at least a year before we have one against COVID-19. We have no partial immunity to the coronavirus as we do to the seasonal flu, even if we have not been vaccinated. Symptoms for H1N1, the swine flu, one of the most severe we've had this century, lasted 4 to 6 days. People with milder cases of COVID-19 are taking 10 to 14 days to recover. Those who develop pneumonia are taking far longer. Finally, the fatality rate for COVID-19 is almost certainly significantly worse than that of the seasonal flu. This has been a particularly contentious part of the debate because early estimates of the death rate were too high, not including asymptomatic people in the calculations. And a study this week shows that as many as a quarter of the people who are infected by this coronavirus show no symptoms. People who opposed the wholesale shutdown of the American economy would often cite a Wall Street Journal op-ed piece by Stanford University doctors who went to the other extreme using the best possible assumptions. They went as far as saying that on March 23rd that there could be as many as 6 million cases in the U.S., which would mean the overwhelming majority would be asymptomatic. Based on that number and the 499 deaths in the U.S. at that point, they said the COVID-19 mortality rate could be equivalent to 0.01%, 1/10 of the flu mortality rate of 0.1%. Of course, deaths in the U.S. have multiplied more than 12 times in the 10 days since. So unless they think 70 million Americans have been infected, they were way off base, and that's putting it mildly. No wonder the doctors already seem to be backtracking. A study published in The Lancet this week, which is admittedly far from the final word on this, it estimates that the mortality rate is 0.66%. That would be 6 times that of the flu. Some will still argue that the deaths are mostly old people, that the increase in suffering and deaths created by isolation and a devastated economy are even worse, causing disproportionate pain to address what might end up being no worse than something that's twice as bad as the worst flu year. We cannot dismiss those very legitimate concerns about the severe consequences of this nationwide shutdown. It has pulled the rug out from under millions of vulnerable Americans who have no financial cushion to tide them over. The unemployment data is nothing short of horrific, the biggest shock to the U.S. economy ever. Millions could be left penniless, homeless, even psychologically impaired. Kids aren't getting educated well. Schools will struggle to have the funds needed to educate properly. Cities will not have the revenue to cover basic needs, and the national debt will skyrocket and burden the next generation of Americans. Breadlines are already forming as people can't afford to feed themselves. This should all be a powerful reminder to politicians in both parties. Stop playing politics with the pandemic. It is a daunting dilemma, almost a Sophie's choice, to balance protecting the health of the American people and the health of the U.S. economy. We need cooperation, not conflict, to minimize the suffering.